BLS Exam 2026 AHA 40 Important Questions Part 3. Question 1. For the purposes of BLS, what age range defines a child? Option A, 1 year of age to 8 years of age. Option B, 1 year of age to the onset of puberty, breast development in females, chest/underarm hair in males. Option C, newborn to 5 years of age. Option D, 3 years of age to 12 years of age. The correct answer is option B, 1 year of age to the onset of puberty, breast development in females, chest/underarm hair in males. In BLS guidelines, a child is defined as someone from 1 year of age up to the visible onset of puberty. After puberty begins, you should use adult BLS guidelines. Question 2. You are a lone rescuer who just witnessed a 5-year-old child suddenly collapse. The child is unresponsive. What is your immediate next step? Option A, leave the child, activate the emergency response system, and get an AED. Option B, perform 2 minutes of CPR, then leave to get an AED. Option C, wait for someone else to arrive before starting CPR. Option D, perform rescue breathing only. The correct answer is option A, leave the child, activate the emergency response system, and get an AED. Because you witnessed the sudden collapse of a child, it is likely a sudden cardiac arrhythmia. You must leave the child immediately to activate EMS and get an AED, then return to start CPR. Question 3. If a child or infant has a heart rate of less than 60 beats per minute with signs of poor perfusion despite adequate oxygenation, what is the appropriate BLS action? Option A, provide rescue breaths only. Option B, perform abdominal thrusts. Option C, start chest compressions along with rescue breaths. Option D, place them in the recovery position. The correct answer is option C, start chest compressions along with rescue breaths. A heart rate below 60 bpm in a pediatric patient with signs of poor perfusion, paleness, cyanosis, weak pulse, means the heart is failing to pump enough blood. You must start chest compressions immediately. Question 4. When using an AED on an infant or child under 8 years of age, or weighing less than 55 pounds, which pads should be used? Option A, adult pads only. Option B, pediatric pads or a pediatric dose attenuator. Option C, no pads should be used, AEDs are not for children. Option D, you must cut adult pads in half. The correct answer is option B, pediatric pads or a pediatric dose attenuator. For infants and children under 8 years old, you should use pediatric pads or a device with a pediatric key/switch to deliver a reduced, safe shock dose. If pediatric pads are absolutely unavailable, you may use adult pads. Question 5. You are using a bag mask device on an adult victim. How long should each rescue breath last? Option A, over 1 second. Option B, over 3 seconds. Option C, as fast as you can squeeze the bag. Option D, over 5 seconds. The correct answer is option A, over 1 second. Each rescue breath, for any age group, should be delivered over 1 second, providing just enough volume to make the chest visibly rise. Question 6. What is a consequence of compressing the chest faster than the recommended rate of 120 compressions per minute? Option A, it tires the rescuer out faster but improves survival. Option B, it prevents the heart from adequately refilling with blood between compressions, reducing overall blood flow. Option C, it causes gastric inflation. Option D, it confuses the AED. The correct answer is option B, it prevents the heart from adequately refilling with blood between compressions, reducing overall blood flow. Compressing too fast, over 120/min, does not allow enough time for complete chest recoil, meaning the heart cannot completely refill with blood, which drastically decreases cardiac output. Question 7. During a resuscitation attempt, the team leader asks you to perform a task, but you realize they made a mistake in the medication dosage. How should you respond? Option A, ignore them and give the correct dose secretly. Option B, use constructive intervention and respectfully correct the team leader using clear language. Option C, yell at them so the whole team knows they messed up. Option D, follow their incorrect order because they are in charge. The correct answer is option B, use constructive intervention and respectfully correct the team leader using clear language. Constructive intervention is a vital team dynamic skill. If a team member or leader is about to make a mistake, you must respectfully step in and correct the action to ensure patient safety. Question 8. Why is it important to select the correct size mask for a bag mask device? Option A. A mask that is too large will not create an airtight seal, and one too small may not cover the mouth and nose properly. Option B. The color of the mask indicates the oxygen flow rate. Option C. Smaller masks deliver a higher oxygen concentration. Option D. Larger masks are required for 2 rescuer CPR. The correct answer is option A. A mask that is too large will not create an airtight seal, and one too small may not cover the mouth and nose properly. To deliver effective ventilations, the mask must cover the bridge of the nose to the cleft of the chin. An improper size prevents an airtight seal, making it impossible to ventilate the patient. Question 9. You are in a moving ambulance performing CPR. The AED indicates it is ready to analyze the rhythm. What should the driver do? Option A. Keep driving at high speed. Option B. Pull over and stop the vehicle completely so the AED can analyze without motion interference. Option C. Swerve to avoid bumps. Option D. Honk the horn to warn the AED. The correct answer is option B. Pull over and stop the vehicle completely so the AED can analyze without motion interference. Movement and vibrations from a moving vehicle can cause the AED to misinterpret the heart rhythm. The vehicle must be completely stopped before the AED analyzes. Question 10. A pregnant woman in her 3rd trimester goes into cardiac arrest. Should you use an AED, and if so, where should the pads be placed? Option A. Do not use an AED on a pregnant woman. Option B. Yes, use the AED and place the pads in the standard locations, upper right chest, lower left chest. Option C. Yes, but place the pads on her back only. Option D. Yes, but place the pads on her abdomen. The correct answer is option B. Yes, use the AED and place the pads in the standard locations, upper right chest, lower left chest. Pregnancy is not a contraindication for defibrillation. You should use the AED immediately and place the pads in the standard positions on the bare chest. Question 11. If a choking infant becomes unresponsive, you should carefully lower them to a firm, flat surface and then immediately do what? Option A. Check for a pulse at the brachial artery. Option B. Perform 5 more back slaps. Option C. Begin CPR, starting with chest compressions. Option D. Perform a blind finger sweep. The correct answer is option C. Begin CPR, starting with chest compressions. If a choking infant, or any victim, becomes unresponsive, do not check for a pulse. Immediately begin CPR, starting with chest compressions, to force the object out and maintain blood flow. Question 12. When performing CPR on an unresponsive choking victim, what is the one modification you make to the standard CPR sequence? Option A. You give 5 breaths instead of 2. Option B. You look in the victim's mouth for the obstructing object before giving rescue breaths. Option C. You perform compressions at a rate of 150 per minute. Option D. You use one hand for compressions. The correct answer is option B. You look in the victim's mouth for the obstructing object before giving rescue breaths. The only modification for an unresponsive choking victim is that every time you open the airway to give breaths, you open the mouth wide and look for the object. If you see it and can easily grab it, remove it. Question 13. Which team role is responsible for overseeing the entire resuscitation attempt, assigning roles, and ensuring high-quality CPR is being performed? Option A. The compressor. Option B. The airway manager. Option C. The AED/monitor operator. Option D. The team leader. The correct answer is option D. The team leader. The team leader coordinates the team's efforts, ensures that all roles are filled, monitors the quality of CPR, and communicates with arriving advanced providers. Question 14. You suspect an adult victim has suffered an opioid overdose. They are unresponsive, but they are breathing normally and have a strong pulse. What is your immediate action? Option A. Start chest compressions. Option B. Place the victim in the recovery position, monitor their breathing, and administer naloxone if available and permitted. Option C. Perform abdominal thrusts. Option D. Give 2 rescue breaths. The correct answer is option B. Place the victim in the recovery position, monitor their breathing, and administer naloxone if available and permitted. Because the victim has a pulse and is breathing normally, they do not need CPR or rescue breathing. Place them in the recovery position to protect their airway and administer naloxone. Question 15. In a 2 rescuer CPR scenario on an adult, what should the ventilator do while the compressor is giving chest compressions? Option A. Maintain an open airway and prepare to give breaths as soon as the 30th compression is finished. Option B. Look for an AED. Option C, check the victim's pulse continuously. Option D, rest until it is time to switch. The correct answer is option A, maintain an open airway and prepare to give breaths as soon as the 30th compression is finished. The ventilator should maintain the head tilt chin lift or jaw thrust to keep the airway open and have the bag mask ready to deliver breaths immediately after the 30th compression. Question 16. When delivering back slaps to a conscious choking infant, how should the infant's head be positioned? Option A, lower than their chest, supporting the head and jaw. Option B, higher than their chest. Option C, level with the chest. Option D, sitting straight up. The correct answer is option A, lower than their chest, supporting the head and jaw. Gravity helps dislodge the object. The infant should be resting face down on your forearm with their head angled lower than their chest, making sure to support their jaw without blocking the airway. Question 17. A patient in the hospital goes into cardiac arrest. They have an endotracheal tube, advanced airway, in place. What is the compression to ventilation ratio for two rescuers? Option A, 30:2. Option B, 15:2. Option C, compressions are continuous at 100-120/min. Ventilations are given one breath every 6 seconds without pausing compressions. Option D, compressions are continuous, no breaths are given. The correct answer is option C. Compressions are continuous at 100-120/min. Ventilations are given one breath every 6 seconds without pausing compressions. With an advanced airway, there are no pauses in compressions for breaths. One rescuer compresses continuously, while the other delivers one breath every 6 seconds. Question 18. While performing chest compressions on an infant, one rescuer, where precisely should your two fingers be placed? Option A, on the upper half of the breastbone. Option B, in the center of the chest, just below the nipple line. Option C, on the lower abdomen. Option D, directly over the heart on the left side. The correct answer is option B, in the center of the chest, just below the nipple line. For an infant, proper hand placement is 1 finger width below the nipple line in the center of the chest, lower half of the breastbone. Question 19. What is the maximum amount of time you should interrupt chest compressions to give 2 rescue breaths? Option A, 5 seconds. Option B, 10 seconds. Option C, 15 seconds. Option D, 20 seconds. The correct answer is option B, 10 seconds. Interruptions in chest compressions cause blood pressure to plummet rapidly. You must deliver the 2 rescue breaths and resume compressions in less than 10 seconds. Question 20. Which of the following is considered a sign of poor perfusion in a pediatric patient? Option A, flushed, warm skin. Option B, strong, bounding peripheral pulses. Option C, cool extremities, pale or blue skin, cyanosis, and a decrease in responsiveness. Option D, a heart rate of 120 bpm. The correct answer is option C, cool extremities, pale or blue skin, cyanosis, and a decrease in responsiveness. Poor perfusion means the body's tissues are not getting enough oxygenated blood. Signs include cool temperatures in hands/feet, weak pulses, pale or blue skin coloring, and altered mental status. Question 21. When should rescuers perform the switch to rotate compressor and ventilator rolls? Option A, every 5 minutes. Option B, when the AED is analyzing the rhythm, to minimize interruptions in compressions. Option C, only when EMS arrives. Option D, after 10 cycles of CPR. The correct answer is option B, when the AED is analyzing the rhythm, to minimize interruptions in compressions. Rescuers should anticipate the switch and rotate rolls every 2 minutes, about 5 cycles. The ideal time to physically switch places is while the AED is analyzing the rhythm, which takes less than 5 seconds. Question 22. An adult victim is pulled from a swimming pool. They are unresponsive, not breathing, and have no pulse. What is your very first action regarding CPR? Option A, perform the Heimlich maneuver to push water out of the lungs. Option B, provide 2 rescue breaths immediately. Option C, wipe the chest dry and begin CPR starting with chest compressions. Option D, wait for the water to drain from their mouth. The correct answer is option C, wipe the chest dry and begin CPR starting with chest compressions. You cannot push water out of the lungs with abdominal thrusts. You should immediately wipe the chest dry, so an AED can be used, and begin standard CPR, starting with chest compressions. Question 23. What is the principle of mutual respect in AHA team dynamics? Option A. Only the doctors are allowed to speak. Option B. Team members speak to one another professionally, acknowledge each other's expertise, and accept constructive feedback. Option C. The team leader never accepts feedback from others. Option D. Everyone must agree on everything before taking action. The correct answer is option B. Team members speak to one another professionally, acknowledge each other's expertise, and accept constructive feedback. Mutual respect means all team members value each other's input, communicate professionally, and focus solely on providing the best possible patient care without ego. Question 24. You are attempting to relieve choking in a conscious 8-month-old infant. After giving 5 back slaps, the object is not dislodged. What is your next step? Option A. Perform a blind finger sweep. Option B. Give 5 inward abdominal thrusts. Option C. Turn the infant over and perform 5 downward chest thrusts using 2 fingers. Option D. Begin chest compressions. The correct answer is option C. Turn the infant over and perform 5 downward chest thrusts using 2 fingers. If back slaps fail, you must support the infant's head and neck, turn them face up onto your other forearm, head lower than chest, and deliver 5 quick, downward chest thrusts. Question 25. Which statement correctly describes how to administer naloxone, Narcan, for a suspected opioid overdose? Option A. It can be administered via a nasal spray device or an intramuscular autoinjector into the outer thigh. Option B. It must be injected directly into the heart. Option C. It is given as an oral pill. Option D. It should be mixed with water and given to the victim to drink. The correct answer is option A. It can be administered via a nasal spray device or an intramuscular autoinjector into the outer thigh. Naloxone comes in easily accessible, pre-filled devices designed for laypersons and BLS providers. The most common forms are intranasal sprays and intramuscular autoinjectors. Question 26. What happens to the victim's chance of survival for every minute that defibrillation is delayed in sudden cardiac arrest? Option A. It stays the same. Option B. It decreases by 7% to 10% per minute. Option C. It decreases by 1% to 2% per minute. Option D. It increases as CPR takes over. The correct answer is option B. It decreases by 7% to 10% per minute. Early defibrillation is crucial. The chance of surviving ventricular fibrillation decreases by about 7 to 10% for every minute that passes without a shock. Question 27. During a multi-rescuer CPR attempt, one rescuer asks the other, "Did you say give 1 breath every 6 seconds?" The other rescuer responds, "Yes, 1 breath every 6 seconds. What communication technique is this?" Option A. Mutual respect. Option B. Knowing your limitations. Option C. Closed-loop communication. Option D. Constructive intervention. The correct answer is option C. Closed-loop communication. Closed-loop communication verifies that a message was heard and understood correctly. The receiver repeats the message back, and the sender confirms it is correct. Question 28. What is the correct way to relieve severe choking in a responsive, pregnant woman? Option A. Abdominal thrusts. Option B. Chest thrusts. Option C. Back slaps only. Option D. Blind finger sweep. The correct answer is option B. Chest thrusts. Because you cannot safely perform abdominal thrusts on a pregnant woman, you must perform chest thrusts by placing your hands over the lower half of her breastbone. Question 29. Why must you physically state, "clear," and look up and down the victim's body before delivering a shock with an AED? Option A. To wake the victim up. Option B. To ensure no one is touching the victim, preventing accidental electrocution of a rescuer. Option C. To tell the AED to start analyzing. Option D. To test the AED speaker. The correct answer is option B. To ensure no one is touching the victim, preventing accidental electrocution of a rescuer. You must visually sweep the victim from head to toe to ensure nobody is touching them. If someone is touching the victim when the shock is delivered, the rescuer could receive a lethal shock. Question 30. What is the correct recovery position for an unresponsive, breathing adult victim? Option A. On their back with legs elevated. Option B. Lying flat on their stomach. Option C. Lying on their side with the lower arm extended, the upper hand under their cheek, and the upper leg bent to stabilize them. Option D. Sitting straight up in a chair. The correct answer is option C. Lying on their side with the lower arm extended, the upper hand under their cheek, and the upper leg bent to stabilize them. The lateral recumbent, recovery, position keeps the airway open, prevents the tongue from falling back into the throat, and allows fluid/vomit to drain from the mouth. Question 31. You are performing CPR on an infant. You deliver a breath, but the infant's chest does not rise. What should you do next? Option A, blow harder. Option B, reposition the airway, retilt the head, and attempt a second breath. Option C, start chest compressions immediately. Option D, attempt a blind finger sweep. The correct answer is option B, reposition the airway, retilt the head, and attempt a second breath. If the first breath does not go in, the airway is likely not opened properly. You should reposition the head, ensuring you aren't tilting it too far back into hyperextension, and try one more breath. Question 32. How deep should chest compressions be for a 6-year-old child? Option A, at least 1.5 inches. Option B, about 2 inches, 1/3 the AP diameter of the chest. Option C, at least 2.5 inches. Option D, exactly 1 inch. The correct answer is option B, about 2 inches, 1/3 the AP diameter of the chest. For a child, compress the chest about 2 inches, which is approximately 1/3 the depth of the chest. Question 33. You are off duty at a grocery store and see an adult collapse. They are unresponsive and not breathing normally. A bystander is with you. What is your best delegation of tasks? Option A, you both leave to get an AED. Option B, you tell the bystander, you, call 911 and bring back an AED, while you immediately start CPR. Option C, you start CPR and wait to see if the bystander figures out what to do. Option D, you both perform CPR together at a 15:2 ratio. The correct answer is option B, you tell the bystander, you, call 911 and bring back an AED, while you immediately start CPR. As the primary rescuer, you should immediately delegate the task of calling EMS and getting an AED to a specific bystander using a direct command, while you start compressions to minimize delays. Question 34. What is the first step in using a pocket mask for rescue breathing? Option A, blow into the valve. Option B, place the mask on the victim's face, using the bridge of the nose as a guide for correct positioning. Option C, push down on the victim's stomach. Option D, attach the oxygen tube. The correct answer is option B, place the mask on the victim's face, using the bridge of the nose as a guide for correct positioning. To ensure an effective seal, the first step is placing the mask correctly on the victim's face, using the narrow end over the bridge of the nose. Question 35. In pediatric CPR, why is the 2 rescuer compression to ventilation ratio changed to 15:2? Option A, to give the rescuers a break sooner. Option B, because children need oxygen delivered more frequently than adults during cardiac arrest. Option C, because children have smaller hearts. Option D, it is easier to remember. The correct answer is option B, because children need oxygen delivered more frequently than adults during cardiac arrest. Pediatric cardiac arrest is overwhelmingly caused by respiratory failure, not primary cardiac issues. The 15:2 ratio provides more frequent ventilations to oxygenate the blood. Question 36. A victim with a suspected opioid overdose has a pulse of 80 bpm but is breathing very slowly, 4 breaths per minute. What is the appropriate treatment? Option A, begin CPR immediately. Option B, provide rescue breathing at 1 breath every 6 seconds and administer naloxone if available. Option C, perform a blind finger sweep. Option D, defibrillate with an AED. The correct answer is option B, provide rescue breathing at 1 breath every 6 seconds and administer naloxone if available. Because the victim has a pulse, they do not need compressions. However, a breathing rate of 4/min is inadequate. You must provide rescue breathing and give naloxone to reverse the respiratory depression. Question 37. When performing 2 thumb encircling hands compressions on an infant, where should your hands wrap? Option A, around the infant's neck. Option B, around the infant's abdomen. Option C, your thumbs press the lower half of the breastbone, while your fingers wrap around the infant's thorax, chest/back, to provide support. Option D, your thumbs press the infant's collarbone. The correct answer is option C, your thumbs press the lower half of the breastbone, while your fingers wrap around the infant's thorax, chest/back, to provide support. The fingers wrap around the infant's back to provide a rigid surface for support, while the 2 thumbs press straight down on the lower half of the breastbone. Question 38. If a victim has water in their mouth but is not drowning, example, they collapsed next to a spilled glass of water, Do you need to wipe their mouth dry before giving mouth-to-mouth breaths? Option A. Yes, wipe the mouth quickly, or use a barrier device like a pocket mask. Option B. No, water is safe to breathe into the lungs. Option C. You should not give breaths at all. Option D. Perform abdominal thrusts to clear the water. The correct answer is option A. Yes, wipe the mouth quickly, or use a barrier device like a pocket mask. While a few drops of water won't prevent CPR, it is best to quickly wipe away fluids or, more ideally, use a pocket mask/barrier device to prevent the exchange of fluids and protect the rescuer. Question 39. When you activate the emergency response system using a mobile phone, what is the most important thing to do? Option A. Hang up quickly so you can start CPR. Option B. Put the phone on speaker mode, place it next to the victim, and follow the dispatcher's instructions while starting CPR. Option C. Wait for the dispatcher to arrive on the scene before starting CPR. Option D. Take a video of the scene. The correct answer is option B. Put the phone on speaker mode, place it next to the victim, and follow the dispatcher's instructions while starting CPR. Using speakerphone allows you to interact with the emergency dispatcher, who can coach you through CPR or AED use, while your hands remain free to perform chest compressions. Question 40. If you are alone and performing CPR on an adult, what is the sequence of steps when an AED finally arrives? Option A. Finish your cycle of 30 compressions, then turn on the AED. Option B. Stop compressions, turn on the AED, apply pads, and follow prompts. Option C. Turn on the AED, leave it running, and do not use it until you finish 5 complete cycles. Option D. Wait for EMS to use the AED. The correct answer is option B. Stop compressions, turn on the AED, apply pads, and follow prompts. As soon as the AED arrives, you must prioritize its use. Stop compressions, immediately turn on the AED, attach the pads to the bare chest, and follow the voice prompts.